Hi everyone. This is Dr. Lodhi. I just wanted to clarify two things in this episode. I'm excited for you to listen to it. The first one is there was a question about when an adolescent woman is going to notice some vaginal discharge. And the answer is usually 6 to 12 months before she gets her first period is when she may begin to notice some vaginal discharge. It's even before she gets the period, just for clarification's sake. And the other thing that I wanted to note, which is very important, is that if someone notices signs of puberty before the age of 9 or has not had a period after the age of 15, that it's so important to be evaluated and seen by your OBGYN. So, those are the two things that I wanted to emphasize, but please have a listen and enjoy the podcast. Thanks so much.
She's an American board certified OBGYN.
She's the CEO of Jobs.mom.
We're women,
We're moms,
we're Muslims,
and we're talking about sex.
This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm Zabeen Mirza.
And I'm Dr. Sadaf Lodhi.
And today we are asking, what's wrong with my vagina?
Before we get into it, the first thing we want to make very clear is we're not giving any kind of religious or medical advice. So if you have any concerns about your health, please speak to your medical provider. And if you have any questions about your religion, please ask your friendly neighborhood religious leader.
Absolutely. And as your friendly neighborhood podcast hosts, we are today going to be talking about, am I normal down there? Is this normal? Does this smell normal? Everything that you might have never wanted to know about vaginal discharge. Now, as a woman, you are going to have vaginal discharge. And if you do not have vaginal discharge, we are going to talk about that as well, because that is an indicator of a deeper rooted issue. So let's get started. What is vaginal discharge?
Sure, Zabeen. The vaginal discharge actually is really important for women. It actually serves as an important housekeeping function in our vagina, in our female reproductive system. And really, vaginal discharge is made up of skin cells from the vagina and the cervix. And they are influenced directly by estrogen. And we'll talk a little bit more about that in menopausal women. But it's really important to know that, to have vaginal discharge tells us that we have estrogen, and typically, we'll notice more of it in our reproductive years. As we age, as we get older, if we're, lucky enough to get older and go through menopause, women will have decreased vaginal discharge, and that's because our ovaries aren't working. And when our ovaries decrease in terms of secreting estrogen, then our vaginal discharge is going to go down as well. And sometimes when women have chemo or go through radiation, and if that affects their ovaries, then they'll have also decreased estrogen, which also will affect lubrication, which will affect the amount of discharge that they have. So their vaginal discharge is directly proportional to how well or how much estrogen they have in their bodies.
Got it. So vaginal discharge is basically our body secreting, right, from the vagina. You had mentioned cells, skin cells, as a result of estrogen, right?
Yep.
And so when do young girls begin to see vaginal discharge? Is it at puberty? Is it even before? When can you expect to begin seeing vaginal discharge?
Yeah, they can see a little bit of it when they're younger, but it's mostly when they start puberty, right? That's when the ovaries really kick into high gear, when they start during our reproductive years.
Yeah.
And we'll see more of that, as the estrogen increases and at different points in our cycle, right? So in the earlier part of our cycle, right before ovulation, we'll see, a different type of discharge. Right before ovulation, we'll see like a clear, they call it like an egg white type discharge. And after ovulation, our discharge is going to be thicker and more cloudy. So definitely, vaginal discharge has a lot to do with our menstrual cycle and where we are in that point of our menstrual cycle.
So what should it look like? What should normal vaginal discharge look like, smell like?
Yeah. So, vaginal discharge, like I was just mentioning, it has a lot to do with the timing of our cycle. So, in the beginning of our cycle, so typically in the beginning, right? So, if we're calling the first day of our last menstrual period, the first day that we have our period, that discharge will be mixed with blood, right? So, women are going through their menses, and that's the first day of their cycle. And then as their menses end, that discharge becomes more clear, and right around the time that they ovulate. So if we're saying that, say a woman has a 28-day cycle, typically she'll ovulate around day 14, right? But that's only if she has a 28-day cycle. If her cycle is longer or shorter, that ovulation day is going to be either earlier or later. And around ovulation, that vaginal discharge will be more sticky, it'll be clear, it'll look like egg whites. And the reason why it's clear and, kind of stickish is because it helps the sperm really get easily penetrate through the vaginal discharge and excuse me, and reach its destination of that uterus, that fallopian tube where it needs to go to get the egg. Um, and after ovulation, then that discharge becomes thicker, becomes cloudy. And that's the color that it becomes until, a woman starts to menstruate again.
So, again, everybody listening, vaginal discharge is normal. It is necessary, right? You are going to see it clear to white, sticky, and varying in consistency depending on what part of your cycle you are in. Should be odorless, right? And you will see it in your underwear. It is not cause for alarm unless we start to notice some deviation from that, such as an odor or color. So, talk a little bit
Yeah.
about what you see in terms of vaginal discharge that is an indicator that something is wrong.
Sure. So, there can be a little odor to the vaginal discharge, not like a horrible, but just maybe like a mild odor to that vaginal discharge. And that's normal. The normal amount of vaginal discharge, I mean, there's no actually, some women will say that they have too much discharge. And I tell them that as long as it's not, causing them irritation or burning or, is like green or something like that, that's okay. It's okay. We don't really measure vaginal discharge, but there can be approximately 1/2 to 1 teaspoon of white or clear, thick mucus vaginal discharge, and that all is normal to have. Now, if you have, you did actually mention, when do we see more discharge than, less discharge? And of course, your menstrual cycle and where you are in that cycle will affect it, but also sometimes with the breastfeeding. Some women will notice that maybe they get a little bit more discharge, and some women can have vaginal dryness with breastfeeding because those hormones are depressed. They are low when you're breastfeeding, the estrogen and the progesterone. And that's because those hormones being low is what allows a woman to breastfeed. So some breastfeeding, lactating women will actually find some vaginal dryness. And also, during the time near ovulation, you'll have more discharge. And, when a woman is aroused, she'll have more discharge. Some discharge that may cause some alarm is, for example, if you have white cottage cheese. I know I don't like that description because then every time I eat cottage cheese, I
Oh,
think
gross.
but it's true. So, if a woman has that kind of discharge, it can be an indication of actually of a yeast infection. So, and that typically when women have yeast infections, that infection can be irritating. It can cause redness, it can cause itching, it can cause burning. So that's why it's so important to be evaluated if you're having those symptoms or that type of vaginal discharge. You can also as we had mentioned in our previous podcast, but in case some people didn't hear it, a greenish, yellowish discharge, specifically one that is frothy, may be a sign of a sexually transmitted disease. So, and that's why that's important to note the color, of that vaginal discharge. It could be perhaps gonorrhea, it could be chlamydia, it could be trichomonas, or it may not be any of those things. And that's why it's important to go to your provider and be evaluated and to be cultured and
Yeah.
screened.
And I think that's so important because even as I like to think that I am above average in my physical awareness of my own body, right, that I am always aware and keeping track of my own body and changes in my own body. Even then, the sight of mucus or discharge every now and then can be very jarring, right, to anyone. And you sit there and you think, oh man, this is a lot of discharge, is something horribly wrong, right, with me. But that's not the case. As long as it's falling within the realm of color, consistency, odor, um, and it's not accompanied with any symptoms like the burning, the itching, discoloration, or a really putrid kind of smell, then it's okay, and it's okay to use penny liners, right?
Yeah.
Penny liners in your
Yeah.
underwear. Now, it's not okay, Sadaf. Tell them it's not okay.
It's
What, like,
definitely not okay.
tell them it's not okay.
No douching.
No douching.
No.
Please do not be a douche and douche your vagina. Okay.
That's right. That's right. Because it changes the pH of the vagina, right? So it gets rid of the normal bacteria that are there to help your vagina, that kind of serve as that housekeeping function of the vagina, and it'll replace it with bad bacteria, which can cause, or yeast for that example, for that matter, and cause like a yeast infection or cause bacterial vaginosis, which is, and I think we're going to get into that a little bit, but you spoke a little bit of bacteria that can cause an odor, and that's the bacterial vaginosis. So bacterial vaginosis is a bacteria that can reside inside of the vagina. It can cause a lot of things. It can cause a fishy odor. It can cause of the vaginal discharge. It can cause you to have a grayish color vaginal discharge. Women will actually come to the gynecologist saying that they have a fishy odor coming out of their vagina. And a lot of times you can tell even before doing like a speculum exam that yes, they have, because just simply from that odor, you can tell that they have bacterial vaginosis. Now, bacterial vaginosis can be caused by douching. It can also be caused by intercourse. And women, sometimes even people that have multiple sexual partners, so that's another reason why it's important to use protection and have your partner wear a condom so that you don't get exposed to all this bacteria that can change the pH of your vagina and cause this vaginal discharge. Bacterial vaginosis has also been noted to cause preterm contractions, preterm labor. So we also, if pregnant women think they have it, we test for it and we treat it. So that's why, Zabeen, again, it's important to know what your vaginal discharge, what it looks like. Typically, even if it has a smell, it doesn't have a smell. A fishy smell can be a sign of bacterial vaginosis. I mean, it may not be, but a lot of times it is. So it's important to be treated for that. And, if you have, and also, sometimes, Zabeen, if a woman has vaginitis, which, irritation of the vagina, where you can have redness or itching or burning. And we notice that, as I say, the cottage cheese, the yeast infection, that can also be a sign of uncontrolled diabetes.
Ah,
So when people come in and they have this crazy infection, yeast infection that say is, encompassing all of their vulva and extending out to their outer thighs, I will ask them, have they had their diabetes, like their sugar checked? Are they diabetic? What's their diet like? And diet plays a big part in a yeast infection. If we're, binging on carbs, if we're eating a lot of pasta, um, that increased sugar in our body is going to allow that yeast to form as well. Because what I always tell my patients is that yeast likes things that are dark and moist and full of sugar. So our body's going to be full of sugar for eating a lot of sugar and eating a lot of pasta, a lot of carbs. And, the vagina is typically a dark area and it has a lot of moisture, right, from the normal vaginal discharge. So that's going to allow that yeast to grow, and if it's not treated, it can become very irritating and, start to spread.
Yeah. And, we can't say this enough, right? If you are noticing abnormal discharge, abnormal color, abnormal smell, the answer is not to douche your vagina with rose, jasmine, whatever Bath and Body Works infused, scent. The answer is to go to your doctor and say, hey, this is what I've noticed. And taking it from there. The vagina, I know you love to say this is self-cleaning, right? It is self-regulating, self-cleaning. So you do not need to stick anything up there and squirt any kind of Japanese cherry blossom or whatever is the scent of the month into your hoo-ha. Please, if you notice something untoward, speak to your doctor. And if you're uncomfortable with just vaginal discharge, which some women are, even the normal vaginal discharge, use a panty liner. They're easy to swap out. Wash with water every time you go to the bathroom, which is something Muslim women and men do. But for those of you that are not Muslim, bidets, the Europeans love bidets, and for good reason. So really start looking into, cleaning with water. But please, be cognizant and be aware of what is normal and what is atypical. So if any last remarks as an OBGYN, I'm sure you have seen some really fascinating, interesting, borderline horrifying things in your practice. You know, any comments to women that, are experiencing some confusion or challenges with their vaginal discharge and general vaginal health?
Yeah, no, I mean, I think that, as you had mentioned before, Zabeen, I think it's important to just kind of be mindful of, what your normal vaginal discharge looks like. And, if something is amiss, if something just seems different to you in terms of, the color or the consistency or something, I mean, I don't think that we have to be hyper vigilant about it, but I just think that, if something seems like it's a little bit off to you, it may be. And so it's important to get that checked out, and green vaginal discharge is never, I mean, I guess on occasion it could be normal, but it's typically not. And especially if it's green and frothy and coming out and, it's causing itching and burning and you're having abdominal pain and you're having fever. I mean, those are all signs that there may be a pelvic, inflammatory disease, a sexually transmitted infection that you may be carrying that needs to be treated. Remember that any vaginal discharge associated with abdominal pain, fever, chills, needs to be evaluated. It could affect your fertility later on in life. So, those are important things to note. If any time you think that your partner may not be monogamous just with you or whatever, whatever your thoughts are, it's just, you should go and get tested. I mean, I'd rather have the patient err on the side of caution and just be evaluated and it be nothing than to go like months and have a sexually transmitted infection and just not deal with it because they're afraid to know what the answer might be.
Yeah. Yeah. And you know what? I really wish that growing up, this was a conversation that you know, I had access to, or I had people willing to have with me as we navigated adolescence and puberty and learning about our bodies. But so that, a lot of women that are listening, younger, older, different stages of their life, I know they're going to find immense value in this. And you are amazing for sharing your knowledge with the world. And I will work on forgiving you for the cottage cheese. But in the meantime, you heard it from the doctor. Don't be a douche. Don't douche your vagina. Green discharge, fishy smelling discharge. Not typical, not normal, especially if you're having symptoms. Please, 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 please Don't stick the jasmine, cherry blossom, or whatever else you were planning to do, up there in the shower. Go to see your doctor, get tested, get treated. Be safe, be well, don't douche. This is the Muslim Sex Podcast. We'll see you next time.